So Jim, what do you see as the biggest challenges we face in the NHS over the coming period?
The NHS is incredibly fortunate in that we've been given a fantastic settlement by the government to protect our level of funding. But the funding staying flat still leaves us with a huge challenge. We've got to see and treat more and more people every year, new drugs, new treatments. And we think that means that we've got to make efficiency savings of about 15 to 20 billion pounds, big number, over the coming 4 years. And that's broadly accepted by politicians, leaders, commentators. It's a challenge we've got to take on. Now, the NHS knows how to save money. It's done it in the past, but it's often done it by letting quality worsen. And we've made a very public commitment that we're going to tackle this problem by driving quality up. And that's really the basis of the QIPP challenge.
We're getting some strong clues about the intentions of the new administration in terms of devolving commissioning power to clinicians, a more patient-focused NHS and a much more independent NHS. What do you think that means for the QIPP agenda?
Well, we're doing this interview, I think, almost exactly a week into the life of a new government, so it's very much about early signals. I mean, your description is right in terms of looking to have more locally driven change. That's completely consistent with the way we've tried to set up the QIPP work, which is not about some appalling process in which the centre instructs people what to do, but asking the question, what needs to be done at every level in the NHS to enable people to respond locally to meet this financial challenge and to drive better services. And so I'm really enthusiastic about the opportunity that this policy direction brings to allow us to liberate more energy and to drive this change through the service.
You've talked about the period ahead as an opportunity for many people in the NHS who are about to knuckle down for the toughest period in living memory. That description might sound a little bit puzzling.
This is without doubt the toughest challenge we've ever faced. I mean, it's my job to be optimistic, but I'm not foolishly optimistic. I'm optimistic based on the analysis we've done of what can be done to tackle this problem. And there is broad support about the things we should do, about driving for safety, about trying to produce better care outside hospital, more prevention, about driving top quartile quality and efficiency performance in every provider. There's really strong agreement about the what. The issue is, how do you do that? In an organisation as large and as complicated as the NHS, how do you take those things that we know will make a difference and make them happen at scale and at pace in a way that will secure the future of this service?
You've expressed the belief that about half of the QIPP agenda can actually be completed through a programme of efficiency. But the other word in your job title, of course, is improvement, which sounds much more like something we need to invest in. Can we afford that investment?
Well, it's a deep cultural belief in the NHS that better costs more. Something that I've done all my life is make a case that I could provide better health services if only people gave me more money, and I think it's really deeply rooted in our mindset. We need more of everything in order to provide better care. Of course, that's not how other industries or sectors approach quality and efficiency. What they believe is that the things that drive quality will also by and large drive more efficiency. And I think part of the fantastic debate that we've been having with people over the last year is beginning to bring that to life and what it means for healthcare. The way I describe it is this: if you keep the system of care the same, if you manage your ward in the same way, or your clinical practice or your hospital, if you manage them in the same way, then yes, if you want to do better, you've got to have more stuff to do it with, more nurses, more doctors, more drugs, more facilities, more beds. If you're prepared to change the way you run that service, then you can achieve more for less. And it's true in the everyday life of our frontline staff. They will talk to you about the waste of their professional time and effort in the way things are organised and how that can be liberated. You know, you could argue that the best way to get more qualified nursing time is not to have a huge increase in nurses, but to liberate the time of our current nurses to do nursing from all the things that distract them, the linen that hasn't arrived, the discharge drugs that aren't ready, the admission information that isn't accurate. If we could make the system work better, then there is a huge opportunity to make patient experience better, better clinical outcomes, better working lives for patients within the current money we've got. And of course our agenda is not to cut money, it's to use a flat amount of money better for healthcare. And I think people are up for that challenge.
We've got used to the idea now that we're going to have to do more with a lot less. But it's also become apparent that in terms of staffing, in terms of management, we're going to have to do more with far fewer people. Is that still a challenge we can meet?
It's tough for managers. I'm one of them. We're going to go through a period where we're reducing in the numbers of people we've got. We've been through a period, of course, where that's been rising very significantly. So we need to maybe see this over the longer term. But it's a tough business to be a manager in the NHS right now. But I would apply the same logic exactly, which is that there is more than enough management capability, leadership capability in the NHS. It doesn't belong to managers. Managers have a particular skill set that they bring. And what we need to do is not to separate off the task of management or leadership of this change to a particular professional group, but to recognise that it needs to come from everyone within the service. There's again a great hunger to do more about clinical leadership. The NHS is relatively unusual compared to most international healthcare systems in having kind of separated off the task of management to be done by some specialist group. In most systems it's a much more mixed in terms of clinicians as leaders and managers and professional managers with particular skills around money or people or buildings. And I think that's the direction we're heading in which we see there's a shared task of leading and managing change to which people bring different specialist skills, and that hybrid vigour is what we need to aim at instead of sterile debates about who's in charge.
You always seem to be incredibly optimistic about our ability to overcome the mountainous challenge ahead. Is that something you still really believe?
I really do. Whether we'll do it or not is an open question. It's going to be a really tough ask. So we're not unrealistic. It's not futile optimism. The reason we're optimistic, I think there are three reasons. One, everything we're doing is based on some kind of evidence of something that's already happening. Like I say, there may be more fantastic innovation out there, but we already know the things that if we stacked them up would make the difference we know. Second, there is huge energy actually out there to do this. We were quite nervous when we started 6 or 9 months ago talking about 15 to 20 billion, that it would deflate people incredibly. I think it's had the reverse impact, which is it's made people think, goodness me, if we care about the future of the NHS, we need to take this challenge on. Now, that's about to get real, and that's going to be a very critical moment as the reality of what we need to do begins to bite and change begins to hit local services and people feel uncomfortable. So I don't want to be unrealistic about translating that good start into what we need to be. That's going to be a bumpy old journey. But lastly, we have no choice. You know, the economic problem is real for the country. It's not going to go away. The only choice we have is whether we tackle it by allowing the NHS that we care about to gradually ebb away into a poor service, or say that we're going to use our collective energies to be determined to reshape it as the service for the future. And I know which side of that argument I'm on, and it's the latter. Just in case there was any confusion, it's the second. We must, it's our responsibility not to be the generation of leaders who took the NHS to a better place and then allowed it to worsen. We have to be the generation of leaders who took it to a decent place and then, in the face of a massive challenge, helped to reshape it to be fit for the next generation.